The Pacific Island population has one of the highest incidence of diabetes, and the diabetes is complicated by end-stage renal failure also. So we have some very significant comorbidities that then parallel cardiac disease and stroke and vascular disease, and we have one of the highest amputation rates in this group. So it allows our practice to really focus on prevention in this group, which also may not have the highest socioeconomic achieved level or educational level. So that's something that our practice really focuses on and cares about. We're starting to have more and more of an addiction problem. A lot of people probably don't realize that we don't have quite the penetration of opiates here as there are in some places like Appalachia or southeastern US, but we have a significant crystal methamphetamine problem, possibly the worst in the United States. It's one of the things that motivated me to take on the role as the chairman of our narcotic policy committee, because I've counted, I have over 200 adoption certificates that I've signed over about the last 8 to 10 years for patients that are 65 and over. And that's because they have to adopt their grandchildren because their parents are so far addicted to methamphetamine or numerous times in and out of jail or just so much not involved in the lives of their children that they have to adopt their grandchildren. And it's meth that is at the root of this. And when we look at what we're dealing with as one of our other major problems is homelessness, meth is really one of our things at the core of it. It's so addictive and it just ruins people's lives. Homelessness is a significant political issue for us right now, but it's a tremendous humanitarian issue for us. One of the things I realize is that homelessness in Hawaii is not an event, it's a process. And a lot of it has been medical and social issues that we haven't been able to address in a preventative manner, that if we start looking at preventing these, we're going to be able to start making a real difference. Statistically in our state, 70% of our unsheltered homeless have moderate to severe addiction, usually multiple medications. 50% have moderate to severe mental illness. Many have comorbidities and co-diagnosis. Until we start addressing that root cause, we're never going to stop our homelessness problem.
So we're here at one of the smaller parks. It's a soccer field here in downtown Kaneohe. We're probably about 3 blocks from my office, and just walking probably 150 yards over here, I saw 5 patients, including one of my patients who was just over cleaning herself in the public bathroom, who unfortunately, as you can tell with her hair loss, was just treated for breast cancer with radiation, but yet here she is, unfortunately, right back on the street. Behind me, on the other side of the stream, there's a homeless encampment, small shanty homes that have been built. This is probably one of our biggest encampments here. You were just sitting with me where the patients were openly talking about addiction. It's pretty common. They're open to talk about it. It's the real problem. And before they're going to get help, we're going to have to help them with addiction. So we're going to help them. I want to get the other people involved.
We need that intervention early on, and that starts at home, and it starts in every primary care office. It starts with education.